Hello, everyone. Welcome to the Approaches to Patient and Public Involvement. Thank you all for attending. Next slide, please. My name is Linda Onerime Prince. I'm the Patient and Public Involvement in NIHR, and I'll now pass you on to my colleagues to introduce themselves.
Hi, I'm Murat Kaur. I work in public partnerships in the NIHR.
Hello, I'm Georgina McMasters. I'm a public contributor and a lay partner with the Academy.
Thank you, Merit and Georgina. Next slide, please. Okay, so in this section, I'll be going over what we're going to cover today. NIHR's definition of PPI, public partnership strategic commitments, why members of the public should be involved in research, and expectations of PPI in NIHR, and also obviously the different approaches in patient and public involvement. Next slide, please. Okay, so NIHR's definitions of public involvement is very much research carried out with or by members of the public rather than to or for them. So it's very much a partnership. You're working together with the members of the public. But I think it's important to break down the three aspects. So first of all, we have involvement, participation, and engagement. Involvement. Members of the public are actively involved in research projects. This is whereby members of the public are actually working with the researchers to actually co-produce the project. So they are partners. So from designing the research to the evaluation of the research, they are actually working together. Participation is where members of the public take part in research. So to give you an example, this may be where members of the public fill in a survey in regards to the research. And then engagement is whereby members of the public are given information about the research. So they could be given leaflets, just general information about the engagement. But in terms of patient and public involvement in research, it's really involvement we concentrate on. So it's about working together with members of the public, being partnership to co-produce your research. Next slide, please. I will now pass you on to my colleague Merit, who will talk about public partnerships.
So because of what Linda said and because of the wide remit of public partnerships in the NIHR, we've coined this term public partnerships to incorporate participation, involvement and engagement. So that covers the breadth of NIHR research. Next slide, please. So we have also, we need to improve certain things in the NIHR, and how we work with people and communities is one of them. And there are 5 key areas that we really want to advance. And so we've set a new strategic direction. So these are called the strategic commitments for public partnerships. And this really focuses and aims to mobilize action on 5 key areas, which the NIHR know that we need to improve. These are here. So there's strengthened partnerships, how we work with lots of different communities and people, and how we ensure that we strengthen those partnerships and the ability to do those. Embed research inclusion, self-explanatory. It sits alongside the research inclusion strategy of the NIHR, but also really just about ensuring that health and care research is diverse and representative and responsive. Improve reward and recognition, which we have a lot of issues with, and we hear complaints about it not being effective and efficient. So how do we ensure that it is more effective, efficient and sustainable? Require feedback, an obvious one, but we still don't do it as well as we need to, and strengthen capacity and capability. Next slide, please. So the strategic commitments focus and encompass all of the NIHR's remit. That includes domestic and global health and care research and work. And then it also incorporates involvement, engagement and participation spheres. Next slide, please.
Okay, thank you, Merit, for that comprehensive detail in terms of our strategic strategic commitments for public partnerships. So in this section, I will discuss the importance of involving members of the public and why involve them. So one of the things is about democratic principles. It is important to involve members of the public in research, especially when this research affects them. And the other aspect is about having a different perspective. So, as a researcher, you'll be coming from one perspective. And when you involve members of the public, you'll be coming from another perspective. So, for instance, if you were doing a research on type 2 diabetes, it'd be useful to have a member of the public who has that condition. So, they'll be able to give their own perspective as a patient, as a member of the public, rather than a researcher's perspective. I think it involves the improves the quality of research when you involve members of the public in research that affects them. It makes the research also more relevant by just having more than various sides of view. So not just the researcher's point of view of the research, but having another perspective. And very often these days, funders and research organizations are really very keen on you involving members of the public, and it's very much encouraged. And it's also obviously being more ethical to involve people in research that affects them. So these are the various reasons why it's important to involve members of the public in research. Next slide, please. Expectations of PPI from NIHR. So this is what in terms of what we expect from PPI. PPI is really at the core of what we do. It's very important to NIHR. We expect the research that we fund to have the PPI section, so we expect researchers to have involved members of the public. In rare cases when this is not done, there must be a very clear justification provided, but it's very much expected that the research you do, that you will involve members of the public. Next slide, please. So now, I will now go into this, the main body of the webinar, how we'll discuss the approaches to PPI. There are varied approaches to patient and public involvement, and these are the broad approaches. So we will go into discuss them in detail. So there's consultation, collaboration, co-production, and user-controlled. So you can use a variety of these methods, or you can choose which one you feel is more applicable in terms of the nature of your research. Next slide, please. I'll now pass you on to my colleague Marriott, who will discuss the approach in terms of consultation.
So some of you may work across or have experienced health and care delivery. And so consultation, it kind of echoes something that we'll do in health and care delivery. So there is a legal duty to consult in health and care. And so this is slightly bordering on using the same approaches as you would do with that. You might be looking at surveys, you might be looking at people and talking to people and things. But in research, we don't have that legal duty, and therefore it is just about trying to understand what people may think of your approach and your research ideas. It can be at any part of the research cycle. It can sit alongside other approaches to how you work with people and communities. But it's just basically about sense checking and understanding actually, is what you're doing, is what you're planning, or is what you're doing, does it make sense to people? Is it the right type of thing? It requires less time from the people that you'll be talking to, but it also means you're not going to get the depth of information. So it's very much a sense check. Next slide, please. A step up from that is collaboration, and this is when you're really working in partnership with each other, researchers and perhaps healthcare staff, working together with lots of different people and communities in partnership. And this is definitely throughout the research cycle. And a key difference from what we've just discussed is here people will be included in decision making. And so when you're working with patients or people and communities and all these different people, they are having a say in actually what is going on and what is going to be done. And that's an important distinction. Next slide, please.
Thank you, Merat. So in this section, I will now discuss co-production. So really, the really way NIHR defines co-production, it's like a partnership where everybody shares responsibilities, everybody's views and experiences are valuable. So it's not just the researcher being at the top and then obviously involving patients that way. They are both at the same level. So there's no hierarchy in terms of co-production. The researcher and members of the public are working together in setting the agenda of the research, in designing the research. So it's really very much again, a partnership. You are co-producing. So these are some of the key principles in terms of sharing that, in terms of co-production. Make sure you share power evenly. As I mentioned, not a hierarchy system. Researchers and members of the public working together, sharing power. Make sure you're including all perspectives and skills. So not just saying, okay, as a researcher, I have these skills. Try and find out what skills the members of the public have as well, and then incorporate that to your research. Making sure you're respecting and valuing all opinions, you're working together, that you're sharing ideas, and you're maintaining relationship. I really want to emphasize the word in terms of co-production. You are co-producing. You're not just giving out information. You're not just, it's not about participation. You're not just about engagement. You're literally co-producing. It's about involvement and you're working together to set the agenda. Next slide, please. I will now pass you on to my colleague, Merit, who will talk about user-controlled research or user-led research.
The user-led research has its historic roots in disabled people's movements, but also in communities of racialized folk who felt that actually research didn't really hear what they were saying and didn't really respond to them, and actually that they were excluded from research. So the thalidomide situation in the 60s, 70s is a really good example of this. You've got parents who had issues, whose babies were being born with specific disabilities and knew that there was something going on here and that there was a situation that needed to be investigated and were ignored for a considerable amount of time. So those type of situations really led people and communities to develop their own approach to research, have their own ways of doing this and focus on issues that really mattered to them. This is a really useful way, and it's been really powerful to see how this research has really helped inform and influence policy over the last few years. So the 5 Times More report, which as you can see in the middle, the Black Maternity Experiences Survey, is a really good example of that. So this report came out, this research was done because of the fact that Black women and brown women are more likely, in Black women's case, 5 times more likely to die during maternity. So racialized community groups started to really take the onus on themselves to say, actually, look, what is going on here? And research that. That then led to a discussion and a debate in the House of Lords and has led to further work being done on this and being supported by a lot of the ministers. So the influence of policy is really interesting. And I think it's really important to see that. There is a sense of, is this research rigorous enough, coming from specific approaches that we take, more traditional researchers take, that is a challenge that user-led research often gets. This research is as rigorous as other people's research. It's not always going to be published in peer review research, in peer review journals. That isn't always the aim. So the way you assess the rigor of it is going to be different. But it is useful research, it's there, and it's really important to acknowledge it as well. Next slide, please.
Thank you, Mariette. So in this section, I'll be discussing organizing and hosting meetings. Obviously, when you involve members of the public, they may more than likely you would want to involve them in organizing and hosting a meeting to, work with them, co-produce a research with them, also gain their feedback. So there are the different various avenues you can use in terms of organizing meetings. So there's planning meetings for face-to-face, planning meetings online, a combination of planning a meeting face-to-face online, and then after the meeting. So I'll now go through each section. So in terms of planning meetings face-to-face, one of the things to consider is the environment. I would say if you can possibly work on the members of the public's own environment. So for instance, if you are involving, again, using the diabetes example, you're involving people who have diabetes and they have a diabetes support group or organization, perhaps have a meeting there in that environment. Consider time and location. I think that's very important. Um, People, obviously, some people have caring responsibilities, some people also have childcare responsibilities. So consider that time, perhaps even avoid things like drop up times in the morning for school and pick up times in the afternoon for school. So make sure you're considering that. Again, in terms of location, you are considering things like disabled parking, making sure that it has good public transport around there. So these are face-to-face meetings. If in this face-to-face meeting you also want to, it's needed that you have overnight accommodation, I would suggest you consider special requirements and dietary requirements. So you ask your members of the public if there's any special requirements that you need to cater for. So, for instance, any access needs, making sure that the again venue has this really good disabled access. Um, Again, there may be attendees who have um, may need support in terms of hearing, so make sure the venue has hearing loops. So really make sure you consider the special and dietary requirements. Another advice is to send information beforehand. So make sure you send all the information about what's expected, how to get there, the public transport, the parking, so that they are very well versed about what's expected. And then set the ground rules. And very often you may want to set ground rules of what's expected if it's people to adhere to confidentiality, what can be shared outside of the meeting and what cannot be shared. So you really provide a comprehensive guide before they go into a face-to-face meeting. So in terms of online meetings, I would suggest another thing to consider really it's about keeping it simple. Use easy software. There's a lot of number of different softwares out there. There's obviously Microsoft Teams, Google Meet, Zoom. Making sure you're keeping it simple by using this software. Send documents in advance and make sure they have all the documents that are needed in terms of online meetings. Another thing to suggest is I'm also have been guilty of this. It's not a in terms of gathering the information you need. When you're doing an online meeting, try not to chair and minutes at the same time or take notes at the same time. If possible, make sure that one person is chairing and another person is taking notes. It's so very difficult sometimes to do to take notes and you may miss things. So try and make sure you divide the responsibilities that way. Again, online meetings can be people need breaks, especially if you're having an all day online meeting. Suggest breaks in between and be mindful of technology as well. So have a backup plan in case, say, the internet fails. I know with Zoom, there's always a dialing number that you can use. So when the internet fails, people can still dial in that way. So make sure you always have a backup plan. So these, again, the tips for planning meetings online. So the next aspect is conducting meetings face to face online. This is a bit more tricky because you're combining two aspects. Again, I'd suggest maybe provide a brief to chair and attendees ahead of time. Perhaps also have a pre-meeting because again, it's combining, people from outside in terms of people attending the meeting online and face to face so that everything runs smoothly. I've been in online meetings whereby, or combination meetings whereby it's a face to face and online. And when you're online, it's very important that you can clearly see the people in the room. So I would say, and clearly maybe have name badges or have like table badges where you have the person's name and maybe the position or the organization, or even if it's just that does have details about who is in the room. It's very important for people who are attending online. Again, have frequent breaks and maybe have breakout rooms as well. And technology between combining these two formats can be a bit tricky. So I'd always advise to say perhaps practice beforehand, making sure that people, the online system is set up and they can hear properly. And then obviously the face-to-face meeting, and everybody on the online can actually see people face-to-face and vice versa. So the last aspect is about the after the meeting for both face-to-face and online. I think it's always very important to, even if it's not a comprehensive report, but to write up a note about the event and send that to attendees. Provide your feedback as well of how that meeting went and what you felt could be useful in terms of what you learned or how it could be improved. Allow sufficient times in between meetings, say if people need to consult outside the meeting and gain more information, and also ask your attendees for feedback in regards to the meeting. So this is just about a comprehensive guide about organizing and hosting meetings, but I do include more resources at the end of this webinar, which goes into more detail how you can have tips in terms of organizing and hosting meetings. Next slide, please. Okay, I'll now pass you on to our public contributor who will give her perspective and introduce herself. So over to you, Georgina.
Thank you. My name's Georgina McMasters, which I've mentioned already. I've been a lay partner with the Academy for 4 years now, so I've nearly finished my stint with them. What I'm going to say is very much a personal view of things, because no one lay partner can speak for all of them. And I think that's the joy of involving a number of lay partners, that you'll get different approaches, different sorts, different experiences. I'm just going to give you an idea of what I have done and how I've got here. I've been involved with researchers for the last 8 years, but before that, I spent about 10 years involvement in primary and secondary care and doing some work for NHS England. So I've done all sorts of things over the years, including being a lay partner on Care Quality Commission inspections, and also doing some assurance work for specialised commissioning. So you'll never know quite what you're getting when you involve a member of the public. So ask them, and then you'll be able to work out the best ways of using them. Over the last 8 years or so, my contribution to research has included helping to tailor research questions to make sure they're what the public would want, what patients would want, as well as what the researcher wants to research. I've guided early career researchers about ways to involve patients, carers, and the public. I've been holding mock interviews for research applicants prior to NHS funding panels, but obviously not ones I'm going to be sitting on. I've been assessing public importance and benefit of research and helping to rank it in order of priority. There's never enough money to go around for funding, and so it often means we need to rank from 1 to 12, and not all 12 will get funded. Had a lot of experience in writing and editing plain English summaries and patient leaflets and public information. I think my own preferences for a plain English summary are nice headings, because it makes it much more readable. Please explain acronyms. They tend to be distinct to particular backgrounds, and a lot of them aren't interchangeable. And please, no jargon. And it's very difficult to assess what is jargon when you're very involved in something. So get somebody else to check it. And if there's any words they don't understand, you need to change them. I've done some work on creating simple storyboards to illustrate pathways and procedures. I did some work on the recovery trial for COVID to explain to families what was going on, because quite often the patients were too ill to make any contribution themselves. I've also helped with a storyboard for explaining informed consent to trials participants. I've done some ethics work, some research steering group membership, been a link between research management and wider PPI groups. I've been doing some work on public awareness and acceptance of secure data environments. I've helped with some researcher training, particularly in the soft skills about writing, recruiting, and working with lay partners. And I suppose one of my favourite things has been able to do some payback for the organisation that funded all the research into medication I'm dependent on, and actually meeting somebody who worked in the lab developing what I take was a wonderful experience for both of us. And I think it sort of validates, when you can actually see a patient who's benefited from your research, I think it's quite important. I've also done co-producing, which Linda's touched on, and been involved in a PPIE slot at the NIHR's annual conference. Right, what I haven't done, I've never actually been a participant in research, because unless you live near a research hospital, you're very unlikely to be invited. And I've never been actively involved in researching anything, although I have done some interviewing for researchers. Just to give you some thoughts about how to find and involve patients, carers, and the public in your research. Linda's already touched on the fact that PPI must be included. My understanding is that diversity, equity, and inclusion must be included now as a condition of public funding. That doesn't mean you've got a quota to fill. You've got to think about who is this research aimed at, and how can I reflect the people for whom the research should benefit? How can I reflect them in my involvement? If a disease or condition is more prevalent in some parts of the world or some heritages, then that's obviously a reason to include appropriate people. I think the one I know most about is that Black men have a far higher incidence of prostate cancer than white men. And so you would expect at least 50% of PPI involvement to come from the community affected, even if they are harder to reach. Are socioeconomics important in your research? You'll all be able to find the willing middle class, but they're not always the sort of people you should be using. Is age important in your research? I've seen a lot of research with a cut-off point of 65, and you think, why? The older people are actually costing the most as far as the NHS is concerned. And so more thought should be including them in your research. Is lived experience important? Linda has mentioned that it is, but beyond lived experience, don't forget the carers of people with lived experience. And make sure you include somebody who hasn't got the lived experience, but could end up with the condition or situation that you are researching, and think about the value of somebody who doesn't know anything about it yet, and what would they want if they acquired the illness or whatever you're researching. Make friends with PPI managers. They will be a very valuable resource for you, both in academic institutions and in hospital trusts. And know who they are, use their skills, that's what they're there for. But don't piggyback onto their existing groups. I think it's important to have your own dedicated lay partners, at least in part, even if you borrow some from another existing group. Charities can be a very useful aid to finding people, but never hand your PPIE works over to a charity, lock, stock and barrel. And that's probably a slightly controversial view, but I have reasons for saying it. Charities tend to work with people who are positive and want to know about their condition. And you will miss out on the hard to reach people if you just go with charities. On a recent funding panel, we came across a research applicant who had handed over all of his PPIE to a charity. They had lost the person who was his contact, and nobody was put in place to take up the reins again for 6 months. So his PPIE was nowhere near ready, and his research application was refused because he'd missed out on the chance for PPIE to be his experience, his learning opportunity, be trained in it, etc. So never just hand something over, because the NIHR is thinking about the development and training of future leaders and not people who are good at delegating. It's your future in the balance, so don't risk messing it up for one aspect. I think I've covered just about everything I wanted to say, but please see lay involvement as a good to have rather than a must have. And I'd like to wish you all good luck in your future research careers. Now hand you back to Linda. Thank you.
Thank you, Georgina. That was a very comprehensive view from a public contributor. Thank you for that. Yeah, a lot of people saying fantastic advice. Thank you. So next slide, please. Okay, in this slide, I'll go over what the additional resources. So just to let you know, once the webinar finished, there will be a pop-up in terms of you filling a survey. It's really useful in terms of us gaining feedback. And once you fill in that survey, obviously, there's a entry about your email address. We will actually send you this slide. And in this section, I want to talk about the additional resources that we've included. So for instance, we've included the Learning for Involvement website, which is the main NIHR PPI website, includes a list of websites, videos, and articles, really useful. And I really want to encourage you to use this website or view it, because it's not just from an NIHR perspective. We also have our public contributors who upload articles to this website as well. There is also NIHR guidance on producing a research project. Again, that really goes into depth about the different aspects of producing a research. And I've also included more information about conducting online meetings. So this is a link to an NIHR useful resource about conducting online meetings. I've also included a link to people in research. This is whereby research can advertise for opportunities for people to get involved in research, and also browse where public contributors can browse in terms of looking to be involved in research. We also have a link to NIHR PPI resources for applicants on research programs, a list of PPI resources for applicants. Then we have our main briefing note for researchers in terms of PPI, which covers all different aspects about PPI, from how to involve people and different aspects of, the approaches to PPI as well. And also, all our webinars, most of our webinars are recorded and put on our YouTube channel playlist, and I've included the link here. This webinar will be recorded and put there, so it's also something that you could refer back to and see all our webinars in terms of how to involve members of the public and different aspects of PPI. Next slide, please. So now we'll now finish in terms of the speaking part of the webinar, and I will now focus on the questions and answers, so we can sort of end the slides, please. Okay. Okay. So I will now go on to the questions. So I'll read out the questions, and I will read the one with the most votes that will answer. And you can pose the question to anyone on the panel, or as a panel will all answer the questions. So I'll start with the most. I've sort of put it the most voted. So one is there guidance on incentive for PPI contributors, and what are the best practice? What works in guiding against folks taking advantage of the PPI process to get incentive but not contribute to research? Yes, we do have, and I'll post this to the panel. We do have a lot of guidance in terms of which is on our learning and involvement website, both for researchers and contributors. And I think we were actually working. I've seen an article about making sure that public contributors are coming from a better, sincere perspective and what to look out for. But I also pose that to the panel if they want to add any further information on that.
Can I add something there? Because
Yes,
I've been
please.
on a number of projects where people appear but make no contribution whatsoever. And I think you should allow people 1 or 2 meetings to find their feet and, pick up what's going on. But when you recruit people to PPIE, make it plain to them that they will be offered work as long as they're contributing. But if they just want to be there, then you're not paying for attendance, you're paying for contribution. So it might sound a bit hard, but it's public money and you ought to be getting value for money. And as I know of one dreadful person who signs on to 2 things at once, so he's claiming £50 an hour, I've had him removed from anything I do, and I've spread the word. But, it does go on. I won't pretend we're all perfect. So set your rules to begin with. I want contributors, not attenders, and then be quite brutal about it, because we're not employed. We can't take you to a tribunal. Thank you.
Thank you, Georgina.
Just to add as well, so as Linda said, there is guidance. It's available on learningforinvolvement.org.uk. But alongside that, what we've kind of really found is that it's about regular reflective practice. It's about actually working together, trying to figure out how to work together, having a clear purpose, and then regularly reflecting on how that partnership is going, what's it leading to, what is the impact of it, what could be improved, and doing that together as a group really helps understand and learn about actually how to do it in practice. The guidance is all theory until you start to really work together, but there is some real great guidance on Learning for Involvement as well.
Thank you. Thanks for that. Sorry, it's not really, so it's just to introduce a chat. Can someone please share the, if you just literally put in the, go for the Learning for Involvement and just literally type what you're looking for, it will come up. Okay, the next question, does NIHR offer small pots to conduct PPI work to inform future grant and fellowship research? So we have this NIHR research support service, so it used to be research design service. Yeah, that does offer a grant, but really it's really in terms of, so it's a £350 grant, but it starts with, in terms of you have to sort of work with them in terms of you preparing your your application to get funding. So it's not like you're in the middle of your research and then you say, oh, by the way, I realize I may need extra funding. No, but that's the other avenue you can use. But we also encourage people if they can also contact their host organizations. But that's the only one I know of, and I don't know if the panel wants to add anything to that. No. Okay, I'll go to the other question in terms of most votes. I'm keen to set up a PPI group specific to my research in the university setting. We do not currently have a group, and we know how valuable it would be to have PPI involvement. Could you recommend the best way to advertise the opportunity to engage a wide range of PPI members as per Georgina's earlier comments? What are the panel's experience in terms of what worked well or did not in terms of advertisement for new groups being set up? Okay, before I come in, I'll put this onto the panel. I don't know if Georgina, you want to come in as a public contributor.
There's a lot of things you can try, because when you're looking for your PPI, you haven't necessarily got a budget for recruiting people. So that rules out an advert in the paper unless you've actually got the money for it. Social media channels are good. Posters in GP surgeries or posters in hospitals, or community centres, anything like that. Or find out who the community leaders are around where you are, and see, tell them what you're doing and see if they can find some people for you to join in. So that there's a few ideas, but you'll know that advertising is expensive, so you've got to be a lot more creative than that and use community leaders, social media, posters in public places. Those are a few to get you thinking.
Thanks, Georgina. And those are the things I was going to add. Another thing I wanted to add, people in research as well. That's the website I mentioned earlier where you could advertise for opportunities. I'll go to Mira.
Yeah, there is also often support groups, especially parents with children of specific conditions. There will be support groups. I just want to come in on the which email do you use? All work with people and communities, any type of engagement with them is still, it still needs to be conducted in an ethical way. So that means using official emails, you know, not sharing personal details if you are working with people. That all should be under regular best practice, just how you would engage any other people. And it's really important that that's followed, so that there is real clarity about what the research is, who's conducting it, who is the authorized organization or university. All of that needs to be really clear, because people need to trust who you are and know what they need to, where they can contact if there is any issue, and if they want to complain, for example. So that should all be covered by your wider ethical protocol of how you conduct this research. This, just to say, engagement is not research, talking to people is not research, but it does need to be conducted ethically. People need to be really clear about what they're getting involved in and who you are.
Thank you, Merit, for that. That's really comprehensive answer. The next I'll go into is, have you got some advice, excuse me, please, about how to best run co-production workshops online? For example, to co-produce an intervention manual or handbook, could you also please talk about your views on the ethics processes required behind running co-production workshops with PPI contributors? What is the distinction between PPI co-production and qualitative research? Many thanks. Okay, so I've said almost like what we discussed earlier. I think with any whether you're doing it face to face or online, is to really be making sure you are also adhering to ethics. So things like confidentiality, setting the ground rules, maybe even privacy, making sure that whatever you do face to face, you apply that online in terms of what is expected. And sorry, just the other question has, so it's moved up now, but does anyone also want to add to this?
I actually I did a lot of work all through the pandemic when everything was online. You can work things very well if you haven't got, you know, you're not physically there. You can't send people to different areas of the room, but breakout rooms and things like that for small discussions and then feeding back works very well. But never try to do it single-handedly. If you want to do something more complicated than that, rope in one or two people to help you with the switching rooms and the technology and everything that goes on with it, because you need at least 2 or 3 people to make a success of that.
Thank you, Georgina. Anyone more comments?
Yeah, just to add, so we actually edited a book during COVID about co-production and how you do it in situations where you need where you're working together, you need really rapid work to happen. I'm going to put it in the chat. Volume 2 was very much about learning from practice that happened during COVID, which will include how do you do it virtually? How do you do it in a really rapid way when you haven't had time to build up the relationship and trust? So that volume 2 might give you some really good examples. But generally, I'd say also, as Georgina said, we learned how to do this during COVID, and there is a lot of learning out there. So do search that.
Okay. Next voted. What is the best approach to recruit, organize, and ensure effective? The question seems to be going. Okay, sorry. What is the best approach to recruit, organize, and ensure effective participation of PPI groups for a pre-study element of research, NHS Trust. Almost like what we've just discussed in terms, we've gone into terms of recruitment, like Georgina mentioned, things like social media, advertising in GP surgeries, people in research. That's how you can recruit, organize. Again, we'll be giving handouts of this presentation. You could go into detail about organizing different meetings, whether you want to do online meetings or face to face. But in terms of recruit, I would say, especially when, you know, perhaps you're limited in budget, always try, see if you could use social media because obviously that's free. Does anyone want to add to this? Mm.
I think it's a nice thing to do to keep a note of how your involvement has actually changed your original thinking. You won't get me asking questions at a funding panel, but one question I've always said is, how have your original thoughts changed by involving other people? And I'm delighted to say everybody has been able to answer that question so far. But do keep a note of it because you are so busy, you will forget things. And also feedback to people you've involved. I've been able to do A, B, and C. Thank you for suggesting it. I couldn't use D because it wouldn't have gained ethical approval, or there was another good reason for not doing it. So it's good to explain why you've been able to use some things and why you've had to chuck out other ideas.
Thank you, Julia.
Just slightly to add as well that I think also there's people really interested in participating or getting involved if it's an area of research or if it's a focus that it matters to them. So having conversations and ensuring that with people just generally, but ensuring that what you're focusing on really matters to people and it's not just something that you think is cool and will advance your career. That's not the focus. It's very much what matters to people. Then you're halfway there. Then it's about, clarifying the purpose and making sure it's inclusive. But it is very much about, why should people bother?
Thank you, Merit. So the next question, given that PPI is a requirement of most NIHR awards, what does NIHR do to ensure that funded organizations are actually incorporating this into their research once they've been awarded funding? Are there any repercussions if organizations are unable to demonstrate they've met NIHR PPI requirements? This is a very good question, actually. And I'm sure there's something in place. I'm not quite sure. I'll liaise with the program teams, but I don't know if Merit, if we can add on to this. But I know obviously they have to state what they are going to do in terms of PPI, but I'm not quite sure of the actual process, how it's checked afterwards in terms of if they fulfilled the requirement.
There are two ways. One is through it's largely through reporting. So we have centres and organisations that we fund have to complete annual reports, and in there will be elements of actually how did you implement things, and we do as teams review the information that comes back. We're trying to get better at sharing that information more publicly where we can, because it's really useful learning for lots of different people. So that is one way. And another way is individuals and organizations that we fund have to use something called Research Fish to, again, report on activity. And there are specific questions about public involvement in there. Again, what we're trying to strengthen is how we analyze and feed back more publicly to individuals, but also more publicly, because that's the element which we think is really useful. It really helps people see what they're doing. Are there repercussions? I'm not sure there are enough repercussions. That's me as an individual thing. But I think I also appreciate it's really hard to demonstrate, to put that into practice, especially when people might be on different journeys with PPI. They may do little bits of it and then suddenly realize the value of it and therefore commit to it. And we do actually also support, there's lots of support within the NIHR central teams to kind of really help people understand actually how they can do this better. So less repercussions, more perhaps peer support to try to strengthen what they're doing. And our public contributors who work with the NIHR are really great at also pushing this as well. So it's multi-pronged.
Okay, thank you so much for that comprehensive answer. That's really useful. So the next one is, what is the difference between PPI and co-design of a new intervention? I'm not quite sure if I understand this question. Does anyone have any thoughts?
And co-design is part of involvement, so I'm not
Yeah,
sure I understand.
I was reading it. Yeah, so I would say obviously, yeah, co-design is part of involvement, just like we mentioned, like co-production is part of involvement. And when you are doing, in terms of PPI, as we discussed, the different elements that you could use in terms of approaches from co-production, to user-led, so different avenues that you can use. So that's the way I would answer it. I would say it's part of PPI. Okay, next question. Why most researchers recognize the potential value of PPI? Actually achieving this potential in practice can throw up many challenges. For many scientists, embracing PPI requires a shift in mindset. Some researchers believe that science is for scientists. Perhaps understandably, a scientist who has dedicated years to their chosen specialism may struggle with the idea of sharing ownership of their work with a non-expert. This is a very good question. Yeah, but it's not in terms of, and this is what we've struggled with when I speak to members of the public. It's not about the researcher and the members of the public having a conflict. Say, for instance, I don't know, if the research is really based on, so the researcher, say for instance, is based on cancer. The researcher will be coming more perhaps from a more theory aspect of cancer, and then the member of the public actually may be coming from a more personal, either they've had um, experience of the condition or have cared for someone from the condition. So it's not a competition in that sense. It's just two aspects coming together, two perspectives coming together and working together. So the member of the public may not know the theory aspect of the subject matter, but they would know the personal aspect, the aspect where they can maybe have a lived experience. So again, it's not about competing, but it's about embracing different perspectives. So I also open this to the panel if they want to add to that.
I think unless you've had the particular condition you're researching, you don't know everything there is to know about it. And if you come up with a treatment that is so awful to take that the public aren't going to go along with it, you've wasted your however many years it was. And also, if you're using public money, why shouldn't the public have some say in how it's being spent? So I would say that, wouldn't I? Just as you take a research stance on things. But, do involve other people, because nobody knows everything about anything.
The evidence that we've got is health and care research is not representative of our populations, that we have treatments and medications that have been trialed, but actually that they've significantly excluded people who are more likely to need that medication or need that treatment. So actually, we do need to get better at this. There is also enough research to show that actually there's an economic benefit of people when they're involved in necessary, for example, creating studies and designing trials, that actually it leads to an economic benefit, that people are more likely to participate throughout the whole range of the study, and they're more likely to therefore continue to lead to the effectiveness of the trial and study. And therefore, I kind of think that actually this view that science is science is wrong. The science that we've got isn't great. It's not accurate. There are people with learning disabilities who are still excluded from trials, especially those that, even for conditions that they're more likely to have. So what is that science, and what are the treatments that we've got then? There are people with sickle cell who've not had a good treatment for the last 20 years, and they've got like 1 or 2 treatments in the same time frame that we've had loads of treatments for cystic fibrosis. So I'd say that actually this view that the science is great, the evidence shows otherwise. So I think that's where we do need to change, like actually how we work, and the knowledge we're producing needs to change as well.
Thank you, Merit and Georgina, for those comprehensive answers. So the next question: are there any courses NIHR providing training for training partner contributions? Yeah, we do have a number of courses in terms of training public contributors. So if you go into the Learning for Involvement website, there's a list of courses that you can advertise to your public contributors. Okay, next question will be okay, those are more comments. Okay. Georgina just mentioned the importance of starting a new group to discuss research rather than piggybacking on another support group. However, the previous talk mentioned going along to establish group. Please, Georgina, from a lay perspective, please advise. So,
Sorry, I didn't catch all of that. Can you read it out
yes,
again?
sorry. Georgina just mentioned the importance of starting a new group to discuss research rather than piggybacking on another support group. However, the previous talk mentioned going along to establish groups. Please, Georgina, from a lay member's perspective, please advise.
Right. I think you can take some people out of an established group. Don't make it the whole group. So I do quite a lot of work for a local primary care department, and just using the same people over and over again, you don't get any new ideas, fresh blood, for want of a better way of putting it. But a small core out of an existing group can help you to expand. But you also, if you're going to be a future leader and you're going to be looking after students in due course, you need to be able to say from experience how you do things, and just learn on the job is basically what I'm saying. Don't just sort of dive in on something that exists already, because you will benefit. We've all learned so much on the job rather than just knowing the theory of it. So, do borrow some people out of an existing group, but then, have your own as well, because you'll never find an existing group that is diverse enough for whatever you're looking at. Okay.
Thank you, Jordan. That's sorry. That was a really good answer.
To add, yeah.
So carry on.
No, I was just saying if either of you wanted to add anything, or whether that's just about answered it. Okay.
Thank you, Georgina. So the next question. Okay, so we've answered one of that's been answered. Okay, there's also the issue of identifying exactly what contribution is requested or expected from patients. Is it solely the experience of living with the disease or condition, or could they offer more? How should patients be selected for participation? Should the researcher aim for patients who are more representative of the patient population, or should those who are most willing or able to contribute be selected? So I'll open this to the panel first.
You'll end up with people like me the whole time if you just go for the willing and able. And we are, people like me do not cover every diversity, every alternative. So, try harder. Don't just go for the willing ones, because they lack the fresh perspective you get from having some newbies. That would be my advice.
Yeah, I want to
one of the issues.
No,
one of the issues that we have is that we often don't work in inclusive ways. So we naturally exclude people just because of the fact that we might work in a hospital building and people might not want to come to the hospital, or an academic centre, and people might not really see that as inclusive, or that they might not have access to things. So I think it is also about just figuring out how you're working and how you kind of create a welcoming society, a welcoming environment, which naturally then will help people be there.
Yeah, I also want to add to that. Let's also think of your subject matter as well and who is heavily affected. So, For instance, if you're doing a research on sickle cell, it's quite important to have people in that group. Certain ethnic minorities are more affected by sickle cell than others, so that you are actually representing the people that are affected. So I would also advise that as well. Okay. Okay, is there specific guidance for PPI groups specifically involving children and young people? If we set up a group of children and young people asking for their input into research, do we need to follow separate practice? Do we need specific consent, etc.? Also, anytime you're involving people who who can't consent to their age requirements, I think it's always best to seek consent from their parent or guardian. So be aware of that. We do have various guidance on involving people, but I'm not sure if there's one specifically on the Learning for Involved website. But I don't know if Merit wants to come in here.
I can help a little bit
Okay.
on this. I know there's some NIHR guidance about rewarding youngsters because you don't pay them £25 an hour, however much they would enjoy it. There's a lot of ideas about, whether certificates, tokens, Amazon vouchers, whatever, are something that would be a suitable reward. You do need parental consent to involve them, but I would suggest that parents aren't actually in the room. They need to be fairly accessible, but not there, because kids are much more open if their parents aren't around. And that's when you will hear, particularly teenagers, really hear what they think and mean. And I know of things like, discouraging people from starting smoking. Actually, having a group of 12 to 16-year-olds is incredibly valuable. So don't be terrified of them. And I asked one person on an interview, he'd already done some work with young people. And I said, what have you particularly learned from it? And he said that he was amazed at just what constructive suggestions the youngsters were coming up with and how keen they were to join in and express their views, because a lot of young people don't feel respected, and it's a nice chance to show that you actually want to listen to them and respect their point of view. So that's just a few ideas that I've seen.
Thank you, Georgina. So we're now coming out to the end of the webinar. I want to thank everyone for attending. And as I said, kindly please fill out the survey at the end. You'll be sent the presentation of this webinar. First of all, I'd like to thank Georgina, a very experienced public contributor. She's worked with me on a number of webinars and other tasks, really valuable at NIHR. I'd like to also thank my co-presenter, Marriott, very experienced PPI professional. She works at based at CED, so she's really offered me lots of advice on PPI in the past. So Merit, really thank you for participating in this webinar. I'd also like to thank the people behind the scenes. I'd really like to thank Stacey, our Learning for Development assistant, who's really helped me organize this webinar and answering the Q&A or operating the Q&A and the chat. So she's been really instrumental putting the webinar together. I'd like to thank Kitan, our Learning and Development Officer, who's helped as well in terms of operating the slides. And I'd like to thank our Communications Officer, James, who's helped in terms of advertising this webinar and putting this webinar all together. So I'd like to thank everyone and yourselves for attending. And really, please, I would ask if you could complete the survey. It really helps us improve the webinars. We really listen to the suggestions from the survey. But thank you, everyone, for attending. Have a good day.
And thank you, Linda. Thank you very much.
Thank you. Take care, everyone.
Okay, bye.
Bye.
Bye-bye.
Mhm.